pre, mamaya. Sige. Kita tayo mamaya.
Uy, bro! Uy! Tagal kitang doon nakita! May abs ka na? Tagal dito ka na pala? Oo, kakalipat ko lang. Bango. Gusto mo maglaro ng court, ma'am? Sa basketball naman sa court?
Maaga pa. Tara, bisa tayo ah.
Uy, okay ka lang? Okay lang ako. Pahinga muna tayo, bro. Tara. Init, solid. Bro, gusto mo ba mag-yossi? May extra kasi ako dito eh.
Pre, alam mo naman di ako nag-iossi.
Sige nga bro, try
Pre,
mo.
ayoko talaga, alam mo. Alam mo naman yan eh.
Sige nga.
Ayoko talaga, pre.
Okay ka lang, babe?
Let's go travel and explore the mystery of what is happening inside our body.
Teacher, I think that is so weird. Tama ba yung narinig ko? Sa loob ng katawan? Imposible.
Yes, you heard it right. Aren't you wondering what is happening inside our body? And how does each part of our body work to stay alive?
That's interesting. I want to discover also what happened in our respiratory. So we will be like air?
That's a good idea. So what now, guys? Are you coming?
Sure! Masaya yan! Sama ako!
Ako din. Let's go! Hoy, relax.
Welcome to your first station, the nostrils.
Wow! Who among you knows the function of the respiratory system? Anyone?
Teacher, the primary function of our respiratory system is to exchange gases. We inhale oxygen and we exhale carbon dioxide.
Very good.
Hey, do you know what those tiny hairs for?
Those hairs are called cilia and they protect the nasal passages
Oh, in what way?
by filtering dust and other particles that enter the nose.
That's correct. The nostrils bring air to the nose where it is filtered, warmed, and moistened.
Teacher, bakit pa tayo nagkakaroon ng sipon?
Because some bacteria, viruses, and other irritants cannot be filtered by the cilia, which can now cause by the irritation or inflammation of the nose. This condition now is called rhinitis.
Rhinitis.
We're not reversing to pharynx, and that area, that is what we call nasopharynx.
Teacher, how about that related to the mouth?
That thing now is what we call the oropharynx. Do you know that there are two main functions of the pharynx?
Really? Aside from carrying air, what else does it do?
It also carries food from the mouth through the esophagus. And that thing behind the hiatal, that is what we call now the laryngopharynx. That laryngopharynx now closes both the larynx and the esophagus.
Wow, so cool! Teacher, what about that thing?
Hello, students.
What's that?
Students, nakalimutan ko pala ipakilala sa inyo. Siya si Siri, ang ating boss. Siri, say hi to them.
Hi.
Annyeong.
Now, those clumps of lymphatic tissue are known as the tonsils, where immune reactions happen. When infected, they may become sore and swollen. That condition is known as tonsillitis.
Rhinitis, tonsillitis, itis.
known as the inflammation.
Brace yourselves, students. A lot of new information is about to come. You have arrived at the third station, the larynx.
It's also known as the voice box.
Why voice box, teacher? Is because of its structure?
I also thought of that.
You guys are correct.
Yes, it is a cartilaginous structure that acts as a passageway for the air between the pharynx and the trachea.
In addition to that, it composes now 3 paired and unpaired cartilage. Look at that thing. That thing is what we call the thyroid cartilage. It is the biggest of all the cartilage.
Look, it's like a leaf.
That leaf shape now is what we call the epiglottic cartilage, which closes now the larynx when we're swallowing to prevent food coming from the larynx.
That's the only reason why it serves as a passageway of air, not just like that of the pharynx.
Hey, try to observe me.
Hey, you can't inhale on your mouth.
Lagi niyo tatandaan, yung sinasabi lagi ng magulang natin, that don't talk when your mouth is full.
That one looks like a signet ring.
And the shape of that is pyramid.
That one resembles a cone. And that is a club-shaped structure.
Those are cricoid, arytenoid, corniculate, and cuneiform respectively.
Basing from what I've seen, epiglottic, thyroid, and cricoid are unpaired.
While the arytenoid, corniculate, and cuneiform cartilage are paired.
Nice! I can see that all of you are learning from this tour.
Teacher, what are those folds?
This folds of mucous membrane that relax during normal breathing and when contracted, vibrate to produce vocal sounds as exhaled air passes over them.
From what you did, when is the vocal cord closed or when it is open?
Open during breathing to allow air pass into the lungs.
And close when it is speaking.
Very good.
Ma'am, are you saying that vocal cords are the one allows us to produce sound?
Yes, that's right, my dear.
So it allows me to sing? Therefore, I can sing because of my vocal cords. Do, re, mi. Eh, teacher, bakit pa naging ganun na yung boses nung nagtitinda ng fishbowl sa labas ng school after niya magperahan?
Oo nga, dati hindi naman ganun no. Naging ganito na oh.
Kaya naging ganito na yung boses ko.
The reason behind of that is because of the recurrent laryngeal nerve is ligated during the surgery.
Kaya kayo kids, treasure your voices. We are now passing the glottis, the gateway to the trachea. Welcome to your fourth station, the trachea.
It is made of cartilaginous C-shaped rings.
It's slow and kept open in spite of the pressure changes that occur during breathing.
Looks like the bus has to unload one passenger.
Teacher, I have something to do. I need to go home.
Okay, take care.
Bye!
Bye, Jessa! Yes, Hazel. It is very long because it is located at C6 and T5 vertebral level and has a length of 4 to 5 inches.
Trivia students, trachea is sometimes called the windpipe. And listen, trachea branches into the right and left primary bronchi, which each enters in the respective lungs.
Lungs? What are those?
Lungs are cone-shaped organs which provide us vital oxygen while removing carbon dioxide that occurs during or before it can reach hazardous levels.
Excellent, Hazel.
Warning! Warning! Mr. Kudal is about to sneeze. Evacuation ASAP!
Students, brace yourself!
Evac in 5, 4, 3, 2, 1. Now, kids, I would like to explain the concept of the bronchial tree. The bronchial tree is the branching system of the bronchi and the bronchioles, conducting air from the windpipe into the lungs. The trachea branches into the right and left primary bronchi. Each enters the lungs. The secondary bronchi has one for each lobe of the lung. The tertiary bronchi are smaller tubules within the lung segments. As you can see, the right main bronchus is more vertical in orientation, with the right main bronchus being wider and larger compared to the left main bronchus. The right main bronchus is wider because it supplies the bulkier lung. It is more vertical because the left bronchus has to pass laterally under the aortic arch to reach the left lung.
Pulmonary circulation is the portion of the circulatory system which carries the oxygenated blood away from the heart to the lungs and returns oxygenated blood back to the heart. The oxygenated blood from your body enters the right atrium of your heart through the superior vena cava and the inferior vena cava. From the right atrium, the oxygenated blood drains into the right ventricle through the right atrioventricular valve. The right ventricle then contracts, forcing the deoxygenated blood through the pulmonary semilunar valve and into the pulmonary artery. The pulmonary artery carries the blood that's very low in oxygen to the lungs where it becomes oxygenated. Freshly oxygenated blood returns from the lungs to the left atrium of the heart via the pulmonary veins.
Pleural effusion is the accumulation of water in the pleural cavity of the lungs. It is due to the leakage of fluid from other organs like the heart, which causes congestive heart failure, the liver, or kidney diseases. Shortness of breath, chest pain, or cough are the symptoms. Antibiotics or thoracentesis can cure this anomaly. Asthma, a condition in which the airways on the lungs narrow and swell and produces extra mucus. This can make breathing difficult, coughing, wheezing, and shortness of breath. Being overweight or a smoker can be the cause of asthma. Medication and asthma treatment plan could be the prevention. Pneumonia, an infection in one or both lungs. It's the accumulation of fluid in the alveoli. It can be caused by bacteria, virus, or fungi. Weak immune system, smoking, or alcoholic can trigger pneumonia. Using antibiotic, antiviral, antifungal drugs can treat pneumonia. Chronic obstructive pulmonary disease, also called COPD, is a common lung disease that causes hardness of breathing, mostly due to smoking. There are two main forms of COPD, chronic bronchitis and emphysema. Most people with COPD would have a combination of both. Prevention is to stop smoking.
Tulong! Tulong! Benji, baby! Benji! Ate, si Benji, bigla na lang nahimatay. Tinakbo namin sa ospital.
Ha? Kailan pa? Ano nangyari? Ano ko rin yung ginawa?
Naglalaro kami ng basketball, tapos niyaya ko siya sigarilyo.
Eh, hindi naman siya naninigarilyo eh.
Hindi ko naman po siya pinilit, pero ginusto niya po akong kasama.
Pasamain ko rin sa kanya. Ay, kuya! What? Dito?
Dito ako.
Hindi namin alam. Ewan ko dito. Please ka nga dito. Pasok! Here's the patient log.
Mr. Von Kudal, you suffered from heart attack. Based on your examinations, the cause is smoking.
That's impossible. I've never smoked.
Then, if that's the case, the cause is secondhand smoking. Are there any instances when you were exposed to smoke?